Assalamualaikum and good morning everyone. I am Teacher Ain. Today I'll be presenting about learning disabilities. The term learning disabilities can be described as a group of problems that affects a child's ability to master school tasks, process information, and communicate effectively. According to National Institute of Health, learning disabilities is a disorders that affect the ability to understand or use spoken or written language, do mathematical calculation, coordinate movement, and direct attention of the child. These disabilities are often not associated with a specific neurologic insult, but it is associated with a variety of neurologic problems such as ADHD. Specific LD or specific learning disabilities are included auditory processing, language disabilities, and also a perceptual impairments. Most children with learning disabilities have an average or above average intelligence. They also have an adequate sensory acuity, which are not blind and not deaf. They also have been provided with appropriate learning opportunities in their life. Despite all of these positive features, a significant discrepancy exists between the child's academic potential and their educational performances. Learning disabilities include a variety of conditions such as perceptual disabilities, dyslexia, aphasia, developmental aphasia, and not included in this category, which is the condition where are stems from primary sensory deficits, MR, socio-economic condition, and also psychosocial impairments. Learning disability is a common problem that encountered by about 5 to 10% of school children. It could be divided into a general or specific learning disabilities. And the terms that are used for learning disabilities included intellectual disabilities, mental retardation, and also learning difficulties. Uh, Learning disabilities is twice more common in boys than the girls, and some researchers suggest that these gender differences are related to the tendency of girls that they are not exhibit a positional defined behavior. So therefore, the girls are infrequently diagnosed with learning disabilities. Children with learning disability usually show a poor academic performances in school, in class, and they also have a poor self-esteem as a result of their poor academic performances. They also show a school refusal and has a emotional and behavioral problem as they are particularly or always often misunderstood and mislabeled as careless, lazy, and stupid. They also have a social problems to interact with other and build a relationship. A child with LD may display any number of behaviors in these nine categories. Firstly, they may show a behavior where they have a disorder of motor function, which included a motor skills and motor activity level. Motor skills dysfunction may range from clumsiness to poor performance in gross and or fine motor skills to planning new tasks to equilibrium deficits to sensory motor problems in a number of areas, sometimes tics, grimace, and choreotype movement in the hands may be observed. The child may be described as hypoactive, which is they are being slow or lethargic, or they can be described as always being in motion, or known as a hyperactive. The second category of behavior that the child with LD may display is an educational disorder. An educational disorder can be occur in one or more academic subjects that they are learning in classroom, in school, or at home. The children which have related educational skills are often limited in copying from blackboard. They are difficulty in printing and writing a cursive words. They also have difficulty in organizing time and materials. They struggle to understand an oral or written instruction or irritant direction, and they also have difficulty in writing, cutting, or drawing, and keeping place on the page. The third one is a disorders of attention and concentration. Examples of these disorder are included a short attention span and other attention deficits. They also show a restlessness where they are unable to sit properly in chair, frequently stand up from chair. They also have impulsivity and have a motor and verbal perseveration. The fourth category of behaviors that the child with LD might be display is a disorder of thinking and memory. These disorders are characterized by a difficulty with abstract reasoning and concept of formation. They also have a poor short and long-term memory capabilities, whereas they are easily forgotten about the things that have been told just now or the things that have been learned before this. The fifth one is the problem with speech and communication. In this case, the child might show a difficulty in shifting topics of conversation. They also have a difficulty with small talks, and they are difficulty with sequencing of words, sentence, and sound. They have a slurred word, which is lack of clarity in pronunciation, and also have an articulation problem where they have a difficulty to producing a speech or a sound accurately and fluently. The next category of behaviors is an auditory difficulties. And auditory difficulties always associated with LD often stem from auditory perceptual and not and auditory memory problems and not from acuity problems such as a hearing problems. So the children with the types of problems are often the one who cannot remember the oral direction that is given to them, where is the no, known as an auditory memory. They also cannot sound out or words or blend sounds into words, which we call a phonemic synthesis, and cannot block out a background noise, which is speech in noise, and cannot remember the sequencing of sounds, words, or numbers in auditory sequencing. So this type of problems often affect school performance and should be explored by an audiologist who is familiar with the specific instrument and programs that are available to assess and treat auditory perceptual, to treat the central auditory processing problem. So the high incidence of allergies and ear infection in children with LD put them at risk for auditory perceptual problems. Children with LD always or often have various sensory, integrative, and perceptual disorder. So these children have difficulty with laterality and directionality in concepts. They also struggle and have difficulty in doing tasks that require visual perception skills, such as a puzzle that require them to match correctly the puzzle to form one images. Next is psychosocial problems. So many of the children with LDs have psychosocial problems that can be manifested as a temper tantrums or antisocial behavior. And the child's social competency may be delayed compared with his or her chronological age or mental age. So many of these children are sensitive and decidedly at risk for poor self-esteem and self-concept problems because they have the intelligence to know when they are being teased and to know the frustration of being good at some things and not at the others thing. Lastly, the child with a LD may display behaviors of specific learning difficulties which accompany the learning disability. So this is most frequently known as a specific reading disability. So specific reading disability often referred to as a dyslexia, which is a learning disorder that characterized by difficulty with accurate and or fluent words recognition. and by poor spelling and decoding abilities. So individuals with dyslexia typically struggle with reading despite having normal intelligence and adequate educational opportunities. Most children with LD retain some degree of disability as adults, but they are most contributing members of society. So, as with all disorder, so the prognosis is affected by the severity of disability. Therefore, individuals with limited impairments or limited disability should not be limited in. So, the occupational therapist's role in an intervention program for the child with LD may be. In conclusion, early assessment and support is crucial for children with learning disabilities and also for someone with learning disabilities. So teaching that use explicit phonological based technique have been found to be effective when started early. In some children, by focusing on just one or two language could be helpful to reduce the stress and frustration, to increase their self-esteem and promote self-concept, and actively looking for their strength and promote them to others to increase their living skills, social skills, and the development of their self. So, stay tuned for the next presentation. Bye bye.